my office. And so when I normally try to go live around 7:30 to 8:30, or between 7 and 7:30, hasn't happened, and it's 8:30 now here in Arizona. So my name is Dr. Adam Nally. I'm a board certified family physician and a board certified obesity medicine specialist. Been in practice about 20 years and specialize in ketogenic diets, low carb diets, and carnivorous diets with my patients. I practice in the northwest corner of the Phoenix Valley. I live in the Waddell area, which is a suburb on the far west side of Phoenix, and coming to you live this evening. I thought tonight I would talk about a very controversial subject. And let me see if I can get it to pull up here. Should I wear a mask? Oops, let me go back here. That's not the one I wanted to pop up. The question is, should I wear a face mask in prevention of COVID-19? One of the big things that people were seeing today, I actually was wearing one as I was out and about. I'm going to put this on so you can see it. This is my mask. My wife actually made this. Now, one of the reasons I'm wearing that versus others is a couple things. Number one, there's a shortage of N95 masks. We don't have very many of them, and we've been asked to let those that are actually in the hospital treating the most severe COVID patients to have them and use them. And so that supply is short, and we're reserving them for those. So I don't recommend buying an N95 mask currently because of that. Second, surgical masks, which are the masks that go over the face and tie behind your neck. We've also been asked to preserve those for medical offices and medical facilities that need them, because those are also still in short supply. So I only have a limited number of those in my office, and if we have patients that are coming in, that we suspect might have COVID-19, we actually give them a mask to put on if they have to come to the office for some reason, or they're being asked to stay at home. Then my staff of those is wearing a mask like this. Now, this is a very simple mask, and a lot of people say, "Oh, that doesn't work." Well, one of the things that's important to understand is we're preserving the N95s for those that are in the medical field, especially in hospitals or have direct exposures. Surgical masks are also in short supply. So those are being used in medical offices, and I am using those. My staff's using those where we can. But if we're out and about or we're having to change out that mask frequently, this is something that's washable, and we'll talk about why we would use it. The N95 masks are effective because they seal, they don't leak, and they actually prevent the inhalation of a droplet. COVID-19 is actually not aerosolized, which means that when you breathe out, it doesn't linger in the air around. It's in a droplet form bound. It's a fat based RNA virus that's in a water droplet, and actually falls to the ground within about 10 feet of the person breathing or coughing or sneezing. So the important thing to understand is that you can't catch it unless someone coughs on you or they touch their face and touch you. So hand washing is key. Cleaning off surfaces that people would touch is key. And then if you're out and about among people you don't know and you don't know if they're infected, you can actually don your own personal mask. Now, some physicians and some experts say, "Oh, it's worthless. You shouldn't even use it. You're going to increase risk because if people wear a mask, they're going to be more likely to go out and think they're safe, and they're not safe." I don't think that's the case. I think you and I are much more intelligent than that. I give you credit, and because my patients are intelligent, and I understand that there may be those that don't get that. But what I want you to understand is this is not just this is actually a triple layer mask. This is designed as a personal protection device. I spent a couple years in Japan as a missionary, and if you look at the statistics of the Asian cultures, most of them have very low curves because they wear masks so frequently when they're sick. They have in their culture, if they are sick themselves, they put a mask on, and then others around them that are worried put a mask on, and it actually notably decreases the transmission of disease. Even if we can decrease the transmission of disease mildly, it's important. Now, one of the things that I was thinking about over the last week is what's the reason to wear a mask or not? Now, those of you who know me know that I do ketogenic diets, and I talk about statins and the fact that if you have cholesterol problems, most doctors are very adamant about giving you a statin drug. Well, the absolute risk reduction, if you take a statin drug, is you decrease your risk of heart attack by 1%. That's the absolute risk of you taking that statin drug. So if you have high cholesterol and I give you a drug to control your statin, that drug only decreases your risk by 1 to 1.2% of a heart attack. But yet we push them out like crazy, and we tell people they have to take their statins. Well, if you wear one of these masks, which is not an N95 mask, but it's a triple layer mask, these have been shown, depending on how they're made and how well they seal, to decrease your risk of transmission or getting a disease like influenza or COVID-19 by anywhere between 10 to 40%, depending on how they fit. So the question is, this is probably more protective than your Lipitor. And so I'm a big fan of wearing these as we start to get into this area where we're starting to see a big upsurge and the numbers of COVID-19 increase. Now, so what is this made of? This is I'm gonna put this up here. This is a triple layer mask. It's got 3 layers. It has an outer, it's cotton. It's actually quilting cotton. Inside is fusible interfacing, and then the next layer on the inside is a fusible cotton. It's got elastic, and it's designed to fit over your face nicely and snugly, so it actually has a fairly good seal. And you can actually use material to seal it or things of that nature. You can even put some wiring in there to cause it to seal even better as well. This one seals nicely over my face, and I actually think this seals better than my surgical mask that I wear at the office. So making them of cotton is actually been shown to be the most effective. The center layer is fusible interfacing, so it's actually 3 layers, which has been shown to notably decrease the transmission somewhere between 10 to 40%, depending on how it fits and how it wears. Now, my wife made these. She's a seamstress, but they're not hard, and so I'm going to put up a link here, which you might want to see, and hopefully you can copy it down. This link, and if somebody wants to copy it or paste it in. I actually may try to, let me see if I can, I might actually see if I can put it in the chat bar. I might be able to do here. Let me see if I can put it in this way. I think I have it there. Oh, you know what? There we go. I put it into the chat bar. So if you want to find this link, Tiana's Closet, and she'll probably get inundated, but she actually had a really nice pattern. My wife looked at a couple patterns. She has a really nice pattern, a PDF pattern you can use for this. It's got elastic on the backside. My issue is that as we start going out and about, we're among people, the numbers are going to start ticking up really fast in the next 2 to 3 weeks, and you're going to see increased exposures to this. This will decrease your exposure by, like I said, 10 to 20 to 40%. And if you have an illness like influenza or something like that, it's going to decrease you exposing other people. So something to consider. Is it perfect? No, it's not. Is it 100% reliable? No, it's not. But it's better than your Lipitor. And that's my big issue is, we have docs that are pushing Lipitor like it's better than baked bread, yet that's only going to decrease your risk of a heart attack by 1%. Yet if we wear a mask, you may decrease your risk by somewhere between 10 to 40%, just in regards to safety, as long as you're washing your hands, not touching your face like I just did, and wearing a mask when you're out and about in an area. Now, if you're out in the woods and you're hiking, do you need to wear a mask? No, you don't. But if you're going to be around other people, then you're going to be within proximity of 5 to 10 feet of people at the grocery store, things like that. Should you wear a mask? Personally, I'm instructing my family and my patients to wear a mask, but wear one that's legitimate. If it's just a piece of, if it's just a piece of t-shirt cotton over your face or some antimicrobial pillow casing, not necessarily helpful. I'll post a study in the search bar down below that talks about looking at these types of masks in 2013. A nice study that was done showing that there is some effectiveness, and the more layers you have, the more effective it is. So hopefully that's helpful. Hopefully that gives you some direction about should I be wearing a mask or not. My concern is that this particular virus is aggressive. It is dramatically more aggressive than the influenza. Only 80% of us are going to be fine. We'll not have any problem at all statistically, as we're seeing right now. 20% of us it'll be a pretty significant disease, and 3% of that total will probably have to be on a ventilator if we don't restrict our exposures and watch those who are immunocompromised and be cautious that way. So hopefully that's going to help you understand and get some answers to questions about, do I wear them? What do I do? How do I do that? Things of that nature. So the nice thing about the cotton and the fusible interfacing is it's breathable. We looked at a number of different materials. The challenge is if you're wearing this all day long, it's hot. If you're in humid climates, it's hot. But the cool thing is this is washable. You can actually wash it, throw it in the washer, and wash it. And so my staff is wearing these. They can take them home at night, change them out, or if they think there's an exposure, they can take that one off, put it in the dirty bag, and then put a new one on. So it makes it nice that way, and we can actually save the other important N95 masks, those where people know they're being exposed, for those that need them until the supply chains improve and things of that nature improve. So I hope that gives you some insight into, should I wear a mask? A lot of people saw me wearing a mask today as I was going out to get lunch. And I put one on because I've got 4 acquaintances that I know of. One of them fairly close that actually are either hospitalized, and one is actually on a ventilator right now. And I have a direct acquaintance whose niece just passed away from this particular virus. So pretty significant, pretty worrisome. And in that regard, I don't want to cause fear. That's not my intent. My intent is not to create worry. Like I tell people, 80% of us are going to be fine. I feel like they had the flu for a day and not a big deal. My big concern is that most of my patients, 95% of my patients are 60 years and older, and they're the ones that are at risk. We're starting to see a number of patients that are in their 50s with metabolic syndrome that end up having this happen. So I thought I would just do a quick post. I know it's real brief, but and hopefully answer some questions about it and get you some question answers there. Hello, Jeannie and Dee, and let's see. Berkeley enjoyed the mask picture. Oh, cool. Nice. It's on Facebook and it's on Instagram. Hello, Rhonda. Let me see if there's some good questions here. Haven't worn a mask or gloves yet. So remember, I saw somebody I was at one of the shopping centers, and this sweet lady was wearing a mask, eye protection, and gloves. And she kept doing this. She would touch her phone, touch this thing, touch her phone, rub her eye. So wearing gloves only protects you if you touch the surface and then remove the gloves. And so wearing gloves out and about is really, in my perspective, not helpful. What's more helpful is you've got a hand wipe or a sanitary wipe or something that's got 60% alcohol, and you clean it off. You clean off the surface you touch, and then wash your hands. Wearing a glove just transmits stuff from one spot to another spot. Unless you touch it, remove the glove, and then go on to the next piece. And if you're doing that and you're walking through a store to shop or to get groceries, you're going to touch multiple things. And so wearing a glove is just transmitting stuff back and forth. But if you've cleansed off your hands, you've cleansed off your cart with some alcohol, you're less likely to transmit things. So that's important to understand. But always better than wipes or things of that nature is basically warm water and soap. That is the most effective way to wash your hands. So hopefully that helps. You are welcome, Patty. I hope that was clear. I know I rambled a bit. I'll try to clarify if there's questions on that. Hello, Mark. How are you? Let's see. Hey, Julie. How are you? Good to see you again. So I put the link up again. That's Tina's Closet. This is the sweet lady that has a great blog. My wife uses her pattern to make these masks, and we've been making them for my staff. All right. Appreciate all your information. Oh, you're welcome, Julia. I hope it helps. I hate having my face covered. I used to work in a clean room, so it's so hot. Linda, I hate having my face covered as well, but having my face covered is better than pushing up daisies. That's my perspective on it. Hello from Cambodia. Wow, Karen. It's good to see you watching us again. Thank you. Have I seen this material supposed to be closer to N95s? I haven't looked at that one yet. A respirator mask made of existing hospital materials. I'll have to look at that one, Allison. I have not seen that one. I've seen a number of mask designs. The challenge is stuff that's accessible for the average Joe like you and I to get. And if you have some sewing skill, or you know someone that can sew and has some seamstress ability. My wife is an amazing seamstress. So she's actually turning out probably 10 of these right now for my staff. But if you have any ability to sew 3 layers of material together and cut out a pattern, it's actually pretty simple in that regard. So, we did some reading all last week, my wife and I and family, looking for something that would be somewhat effective, that would at least provide some benefit. And what we found is that cotton, a simple quilter's cotton, with an fusible interface lining in the middle and then another layer of cotton, seem to, in some cases, protect from bacteria up to 40%, and the smallest viruses 10 to 20%. So it is giving you some benefit. Again, more than Lipitor. So hopefully that helps you understand that. Check out masksaveslives.org. A lot of supportive stats for what I'm saying. Oh, thank you, Allison. I will have to look at that link too. That's great. I appreciate you putting that out there. I figure I'll leave my house by September or maybe, says Cheryl. Okay. Allison, let me post your link. You said that this was Mask Saves Lives. I'll have to check that one out. Thank you for posting that, Allison. I will look at that one too. I had not seen that one yet. Thank you. Let's see. That was Cheryl. I posted that. Let's see. I cut up a HIPAA allergy vacuum bag and line your homemade one with that. That's great. The allergen bag is like fusible interfacing, really nice. It has a very fine weave that only lets very, very small particles through. And what we're finding is that when you do 3 layers, 3 layers was not too hot, but enough to actually trap, like I said, 10 to 20% of the smallest particles passing through there in and out. Let's see. There are 2 known cases in my county. Hopefully you didn't pick up this critter. Hopefully you didn't know. I hope you didn't, Phyllis. My ordering a Z-Pack and hydroxychloroquine for. I have not had anyone with COVID at this point in time. Thank goodness. Knock on air or wood or whatever. I use hydroxychloroquine with multiple patients for a number of other issues in my office, and I have been using azithromycin for years with patients with bronchitis and things like that. So I'm comfortable with both drugs, very comfortable with both drugs, and have no problem using them if we needed to use it for someone who's ill and actually truly has it. But again, it's being used off-label, and it hasn't been approved by the FDA specifically for that. But as physicians, one of our licenses allows us to talk about the pros and cons of the patient, explain this is being used off-label at this point in time, and then consider it if it seems appropriate and the person doesn't have any problem with those medications and the side effects that can arise with any medication. Husband's a landscaper and he doesn't have access to soap and water. So Roseanne, if he doesn't have access to soap and water, then providing him some kind of an alcohol wipe or even a Clorox wipe. In my office, if we're out of alcohol, we'll actually use a Clorox and water mixture, which actually works nicely, very, very, very effective in killing things. This virus dies within 10 seconds when exposed to Clorox or alcohol. So that's not the drinkable kind. It's isopropyl rubbing alcohol. Hello from Mississippi, Belinda. It's good to see you. Let's see. Do you think wearing masks is going to become a new normal? Pam, half the people I talk to think that this virus is a hoax. My worry, that's my worry, is that half the people out there think that this is just craziness and that the government's trying to control us. I don't think that's the case. I think that this is a significant virus, and I think our government understands that. I think they have some data that they have probably not shared with us in regards to other countries, and who knows in that regard. But what I've seen, what I've heard, and with the docs that I've talked to that have actually treated this, it's significant, and it scares me. It scares me because every one of the patients that has been hospitalized has metabolic syndrome. They have insulin resistance or impaired fasting glucose. They're pre-diabetic or they're diabetic and have complications of diabetes. Most of them are 50 and older. And so that worries me greatly because that's 85% of the people that walk through my door. But half the people I talk to think this is a hoax. And I mean, you got to do what you got to do. But as a physician who has seen significant illness and a physician who's never seen these type of numbers occur, I have never seen influenza cause double pneumonia and kill a person in 9 days. Never seen that before. This virus does that to those that are ill. So that's what worries me, and because of the way this presents, because of how rapid it is, and because there's no great treatment available that we have put our hands on yet. Although there's a number of things that are effective in small groups that we've seen it. That's the big challenge. So is wearing a mask going to be a new norm? Maybe for a month. I don't know. For those that see me and talk to me, I'm recommending if you're out and about and you're going to be exposed to people that you don't know about, and you may be within proximity of 5 or 6 feet of them, you're at the grocery store for some reason, you're at the gas station, my family's donning masks and they're washing their hands. So I hope that gives you some insight. Thanks for saying that about wearing gloves in the store. The glove issue is a problem. If you're a checker and you're touching things constantly back and forth, there's one thing about their constant exposure in one space, but for people walking around, they're just spreading stuff around the room. That's a totally different issue. You got to understand why you're wearing the glove and how the glove works. Thanks for the update. You're going to raid my craft closet. Nisha, my wife was in the closet last week pulling this stuff. This is my Star Trek mask. You gotta see the Star Trek. So I love Star Wars and Star Trek. Those are my two of my favorite shows. So my wife's making me a Star Trek mask, a Star Wars mask right now. I love Star Trek, love Star Wars. All right. I was gonna wear my Darth Vader helmet, but my wife didn't think that would go over so well with my patients. All right. Washington Post put up a nice consideration. And again, because the data is fairly weak in regards to, it doesn't stop 95% of the disease. No one said wear your mask. However, when you look at other drugs and other things that we accept as standard of care for treating cholesterol, if I'm going to give you a Lipitor and say, hey, you got to take this Lipitor because it's going to decrease your risk of a heart attack by 1%. Why not wear a mask that's going to decrease it 10 to 40%? That's where I'm saying, this seems asinine to me that we don't look at those numbers appropriately. I wore my mask to Sam's Club today. I'm proud of you, Ben. You're a good man. Love it. I wore my mask to In-N-Out Burger to get a hamburger. So it was great. I went through the drive-thru, but anyway. And I didn't have a bun. It was a I always get mine Flying Dutchman style. They're quite tasty. One case in my son's apartment building in San Antonio. Oh wow, Kathy. So it's hitting close to home. It's getting there. It's getting close to home for a lot of us. Can your husband put jugs of water and some soap in his car truck? He washes his hands when. Oh, yeah, that's a way to think about it, Pam. Yeah, carrying your own soap and water out. That's a good way to think about it. I work in the fabric store, and we have been selling cotton pillowcases. So yes, so I know that people are buying them. They're buying the pillowcase fabric because it's a thicker, it's a cotton weave. It's a little more breathable in regards to heat. But when you layer it with interfacing in between, it seems to be fairly effective according to what the studies that are out there show. Thank you for debunking the conspiracy nuts. Yes, crazy talk, not a hoax, says Kathy. Very true. All right, are doctors making the connection yet? Yes. Well, those of us that have been talking about insulin resistance for years have made the connection. We made the connection a couple months ago. There are still doctors out there that go, well, if you have hypertension and heart disease and you've had a stroke or you've got vascular disease, then you're at major risk. Well, remember, that's why I wrote the Keto Cure, which is my book, and this is going to be a shameless plug for my book. The 16 diseases caused by insulin resistance are in here: hypertension, heart disease, kidney stones, stroke, atherosclerosis, gout. These are all driven by insulin resistance as an underlying factor. And that high insulin response to control your blood sugar, causing you to have a slightly elevated fasting sugar in the morning above 100, is the risk factor that makes this particular virus much more deadly. Pardon me, my throat's. I have allergies today. Excuse me. Those allergies are draining. All right, how can anyone look at Italy and think it's a hoax? Exactly. Oh, excuse me. All right, I do not have coronavirus. No, I have allergies. All of our rain and pollen. You can hear it in my voice, I'm sure. All right. Do you think America will start making more medication here? Yes, I think we will. We've already started doing that. Mask Makers Unite Facebook groups and multiple patterns. Nurses here in hospitals are asking for masks. Yeah, I know that there are nurses in the hospitals, and bless their hearts, because they don't have enough masks there. I know some of the hospitals have now allowed for wearing the personal protection mask that's because they don't have access to the surgical mask or the N95 mask as they're moving through the hospital systems. Excuse me. The allergies kick in. All right. Hello, Oregon. Hello, Muriel from Oregon. I feel like I'm getting paranoid about everything, especially groceries. Any suggestions on bringing purchased items such as groceries into the home? Remember, Pam, and that's a good question. It's a legitimate question. We know the virus can live on surfaces for up to 48 hours. So let's say someone walks by and coughs on that item and they happen to have the virus. Well, if you've washed your hands and you're washing your hands when you come in, hopefully you're in your preparation of items, you're cooking them or you're cleaning them off before you open things up. If you have a can, you're cleaning it off with soap and water or some sort of cleansing approach. If you feel the need to wipe things down as you walk in the house, I think that's appropriate. There's nothing wrong with that. There's nothing wrong with that as a safety issue or a safety item. Most of the food you eat will be wrapped anyway. And so if you're washing your hands off and you're cleansing the items, shouldn't be a big deal, especially if there are things you're cooking. And if you're eating real food, you're probably cooking it and washing it. If it's a boxed food and you're watching me, I'm going to tell you no, because that's probably garbage. And so you need to give that to the neighbor you don't like. Did I say that out loud? Sorry. All right. Let's see here. 5% is better than 0%. It actually is, Kathy. And that's what I'm trying to say is any percentage is better than none. And so is wearing a breathable mask that you can wash every day a bad thing? No. Is it going to scare people? No. It's going to be protective for you and for those around you. So I see no reason why people should give you the stink eye for it. And if they give you the stink eye, just give it back to them. Avoid them. Or like I said earlier today, if they start giving the stink eye, just start coughing really heavily and watch them scatter. And then you get a kick out of it. Are doctors other than you seeing the connection between, I think I answered that question, Linda. Let's see here. All right, let me see. My allergies are driving me crazy. Postnasal drip, worst. Yeah, I'm seeing a lot of allergies in my office. Do you know any labs in the US that are able to draw an antibody titer yet? I'm told they're working on it. I don't know of any labs that have made themselves aware to me. I know the two labs I use in my area are LabCorp and Quest. I know that I was under the impression that LabCorp is working on a titer. I don't know how soon it will be available yet, and I don't know the false positive, false negative rates on those. They haven't said anything to that. Haven't said anything to us about that yet that I've seen published for the regular medical offices. Have I seen Jaco's response about healthcare workers wearing masks? My thoughts. I haven't seen any recent published report from Jaco, Kimberly, and if you know what it is, I'd love to see it. What I have seen is my hospital sends me a note saying Jaco doesn't necessarily recommend it because it gives people a false sense of security. But if a person is feeling anxious and wants to wear in my hospital, they will allow you to wear your mask. You just can't take it on and off, and it needs to be washed and cleansed on a regular basis. And then if you're going to enter a room that has an increased risk, you need to don the personal protective equipment that the hospital is providing for that. I don't know if there's more to that than that you've seen or you've got. Let me know. I'd love to read that. All right. I spray my surfaces around the house with 70% isopropyl alcohol. It does wonderful good, Ruth. Anything higher than 60% isopropyl alcohol kills the virus in 10 seconds. This particular virus and most viruses in 10 seconds. So yes, it's wonderful. Just don't drink it. Do you have any recommendations for healthcare workers who are higher risk due to autoimmune issues and insulin resistance? So, Sarah, if you're a healthcare worker and you have insulin resistance, the key is if it's under control, you're doing well. One of the things I told my staff is if you have insulin resistance and you're eating donuts, you're causing yourself a problem. If you have insulin resistance and you're eating a low carbohydrate ketogenic or a carnivore diet, you're actually protecting yourself, and your immune system is probably doing great. So I wouldn't worry. If you have an autoimmune issue and you're following a ketogenic diet, probably the best thing you can do. Is it 100% protective? No, but nothing is. And so if you're eating healthily, you're getting good sleep, you're exercising regularly, you're doing all the things to improve your risk, I wouldn't worry. Do your job and don't worry about it. If you have totally out of control diabetes or totally out of control rheumatoid arthritis, then that's a person that I would say probably needs to work from home if they can, or do, I have some patients that are out of control. And those are patients that I'm recommending they quarantine themselves for a few weeks during this period of high peak. So something to consider. Kimberly, I'm assuming the link you posted there is the link to Jaco. Hopefully I'm assuming that's what this link is. I'll have to check that out. There's no way I can look at it here, but I'll check it out. All right. Wearing an insulin pump, struggling to keep keto. I may need to go into our SNF for onboarding. I'd like to wait it out. Wearing it, struggling to keep keto. So Lori, my question is, you're insulin resistant. You're on insulin. You're wearing a pump. Why are you struggling to keep keto? Because you're craving. You're falling to cravings. You can't keep your hands to yourself. The fridge calls to you and doesn't swear at you when you open the door. I guess my question, and I'm being facetious and patronizing a little bit, but if you're at risk and you're on an insulin pump, my issue is every time you're tempted to cheat and eat bad, why don't you think about why you're doing it? What's your reasoning for doing it? I don't necessarily know if going into a SNF is going to help you because you're going to be exposed to a whole bunch more people who probably aren't controlling theirs. So my concern is, are you onboarding the insulin pump? I'm not quite sure what you're asking about that there. And so without knowing your history and background, I can't really give you a good medical advice, but my concern is if you're struggling to follow keto, why are you struggling? Is it because you have, because you don't think you have willpower, or there's some reasons that behind there. We all do things for reasons. There's a reason for everything we do. Plain and simple information. You're welcome, Debbie. Hopefully it's helpful. Should we all wear masks when we go out? Should we change clothes when we get home from shopping? So, if you were out and about and you weren't really close to many people while you're shopping, I'm not horribly worried that you need to change out your clothing when you're out and about. But if you were near someone who was hacking up a lung and they weren't wearing a mask, then I'd be inclined to probably change my clothes. When I get home, I change my clothes because I get exposed to 30 different people a day. But should we all wear masks? Again, wearing a mask like this, it decreases incidence, as we see statistically, if it's a triple layer mask made correctly, between 10 and 40%, and depending on the type of bacteria or virus it is. And so it's going to give you some additional protection. Should you wear it? It's a personal choice that you need to make. Personally, I'm wearing one. I'm encouraging my family to wear one, and my patients, I'm encouraging them, if they're going to be out and about exposed to people, that they should probably wear something that's good. Now, I don't recommend using the surgical masks because we need to save those, and I don't recommend wearing N95 masks because those are in short supply, and we need those for our medical personnel that are in the hospital and really doing the dangerous work. Hello from Seattle. You are welcome, Gracie. I hope you're having a good time in Seattle and that you're not exposed to all sorts of craziness up there. My 29-year-old cashier at Fry's, should she wear a mask, gloves, trying to keep her distance? So, if she's a cashier at Fry's, she's going to be exposed to a lot of people. If Fry's will allow her to wear a mask, I probably would wear one. Although there may be some the store itself may have some protocols they have to follow in that regard. I don't necessarily know if wearing gloves is going to help her that much, other than she needs to wash her hands regularly, have some wipes on that area that she can wipe down regularly. Most of the grocery stores I've seen are doing that. So I would say make sure that they're using hand sanitizers, don't touch the face. If you're wearing a mask, you're not likely to touch your face with the mask on, unless you just love to pull on your mask, but it's something to consider there. All right. You are very welcome, Sarah. My hope is that I'm giving you some reassurance. I'm not making your fear worse, that you are understanding why would I wear a mask and why wouldn't I? What's the reasoning? If I'm out hiking in the mountains on a trail and there's very few people, I'm probably not going to wear a mask. I'm going to leave it off. But if I know let's say I decide to go hiking with my family and there's a bunch of people on that trail that I probably might put my mask on. So I'm going to probably carry my mask in my pocket. So something to consider. Allison lived in Okinawa years ago. Good Air Base. Are you military? Donnie, I was actually a missionary for my church in Okinawa for 2 years there. Let's see. Rumor is that taking ACE inhibitors and ARBs does something like so. So remember, well, we've talked about it before Roseanne, but the ACE inhibitor and the ARB uses a signaling enzyme that this virus actually enters the cell through. So using an ACE and ARB has some effect on the entrance of this particular COVID-19 virus into the cell. And they found that those that are on the ACE and ARBs, that because of the effect on the kidney and what happens, that there is some increased transmission risk with the use of those drugs. If you're on an ACE or an ARB, I would talk with your doctor about the pros and cons of being on that drug. They're great medicines when it comes to protecting the kidneys as a diabetic, treating the blood pressure, treating heart issues. So there are some tremendous benefits to being on them. The question is, if you're on them, does your doctor want to keep you on them? Or would that be something to consider changing because of risk factors that you may or may not have? So it wasn't the ACE or ARB that caused the death. It was the actual virus. It was the fact that the people that died had other comorbid complications in that regard. They think the ARB played a role, but again, there's still a lot of information that's up in the air on that. And so I don't necessarily know if I can give you a real clarity, because there's some studies that are out there. Some are saying, you should, if the person's admitted, take them off. But again, you have to wait. Every drug has a tremendous benefit and every drug has a risk, and you have to weigh the pros and the cons of the use of those medications. It's just, I'm a big proponent of better living through chemistry. But if you understand that chemistry is inhibiting you for a certain way, we want to change that up if we can. Thank you, Tracy. You had to watch on replay. Well, good. All right. Sorry, me again. I can't get my regular groceries, so doing very lazy keto. I'm in marketing, but need to be in the sniff for a new job. SNF. Explain SNF to me. Spell that out, because I'm not sure what that means. SNF, is that the sniff unit in a hospital, or is that that acronym is not one I'm familiar with. I don't want to go into the facility. Would you recommend working from home until the quarantine is lifted? Well, Lori, the only reason I would recommend someone working from home is if your city or state has recommended it, number one, and you have a non-essential job that can work from home, or if you're immunocompromised. And again, that's a medical history issue that, if your blood sugar is not in good control with your insulin pump, then that would be one issue that I would talk to your doctor about, because some employers are requiring a letter from their doctor to do that. So you may need to check that. What is the Tylenol connection? There is no Tylenol connection, Cheryl. If someone says that, there isn't one. You are so smart. Only in my dreams and on television, Linda. Let's see here. Gracie Eckert. Hello from the sea. Oh, great. When you are done, can you post the link for the mask pattern? I actually did, and I will. It's posted in the scroll bar. I will post it here again for you. This is the Cool Ladies blog, Tiana's Closet. And this is where my wife found it. It's there, and it's in the chat bar. So scroll up if you haven't seen it. You can find it there. SNF, skilled nursing facility. So the challenge is that a skilled nursing facility is a breeding ground for disease, Sue and Lori. So the challenge is that if you are a non-controlled diabetic, your risk is probably higher. And then that would be something to consider with your employer and your doctor as to whether a work from home option is okay for you for the next 2 to 4 weeks, depending on what your city is requiring, what you're doing. Hopefully that answers that question. So you as a sniff. Okay, good. Thank you. I appreciate you guys saying that. All right. All right. Thank you, Tracy. Let's see. Any other amazing questions? You guys are asking really good questions. All right, let me see if there's any others here. All right, well, you guys are great. So again, just a very simple summary and cap. Should I wear a mask? Number one, I would not recommend the public using the N95 mask or the surgical masks, because you need to save those for people that truly are being exposed every day to live virus. So don't go out and buy surgical masks or N95 masks. Leave those for the people that truly need them. But would a mask be helpful? Well, this type of a mask, a triple layer mask made with cotton and interface lining and then cotton again, which is a 3-layer mask that's fitted to your face, has been shown to be between 10 and 40% effective in influenza virus and various small bacterial forms. So it has some benefit. Now, people say, well, that's not very much. There's still 60% chance you're going to get the virus. Well, yeah, but if you take Lipitor and you have high cholesterol, you're only decreasing your heart disease risk by 1%, 1.2% at maximal doses. So we as doctors are telling people, take your Lipitor, yet don't wear a mask. I think that's asinine. That's stupid. So let's look at there's my cute wife. She's walking through. Hey, oh, look at that. She made more of them. Awesome. So, she made my Star Wars. Oh, you guys get to see me don my Star Wars mask. Look at this. Oh, yeah. Look at that. Star Wars mask. Thank you, dear. So she just made me my 2 Star Wars masks. So now I have Star Trek and Star Wars, and you get to see it. Isn't that awesome? Okay. So thank you. That's my. So again, she just whipped these out literally in like 30 minutes. It's a 3-layer mask, cotton interfacing in the center. It's a fusible interfacing, and then cotton on the inside. It's washable. It has an elastic back. Check out the website. It's great. My wife hates to be on camera, so you got a glimpse of my wife for just a moment. Let's see. With the comorbidities of heart, type 2 diabetes, is it beneficial to beg for hydroxychloroquine? Carol, it is not beneficial to beg for anything unless you truly are positive and you're symptomatic. I would not take the risk of taking hydroxychloroquine and Z-Pak together unless you were truly symptomatic and you had a positive COVID-19 test. I'm not going to give it to patients unless they have that risk, because there are significant risks with hydroxychloroquine. I can cause anemia. I can drop your platelet count. I can make you sick as a dog, and I can cause something called red man syndrome, which a side effect of itself can kill you with that particular drug. There are specific risks associated with those drugs that you need to be aware of, and the risk to benefit ratio has to be correct. Am I just going to give out hydroxychloroquine and Z-Pak to anyone and everyone as a preventative measure? Absolutely not. I think that's horrible, bad medicine. Now, if you're exposed and you're symptomatic, then that's a whole different story. We talk about treatment and pros and cons there. All right, let's see here. I hope that answered that question. Let's see. Why to illness like this makes asthma worse? David, I'm not quite sure what you mean. Can you clarify that, David? And I'll try to answer that question. I'm not quite sure what you're asking there. Let's see. Which church in Okinawa? Let's see. Hubby's a civilian, former Marine. I was a former LDS missionary I served a 2-year mission in Japan and was in Okinawa for most of my missionary time there. So I love that area. It's a beautiful area. Let's see. The comorbidities of, we answered that question. All right. Live long and prosper. Yes, Wendy, thank you. I just heard the Darth Vader march in my head. Love the mask. Excellent masks. Yes, thank you. Does putting the mask in the oven kill the germs? Putting the mask in the washing machine with warm water and soap kills the germs, Kathy. They actually showed that 116 degrees does not kill the virus, but soap and water pulls it off, kills it because it takes away the outer coating, so it inactivates the virus. Alcohol or Clorox doesn't. Loves the mask, says Kathy. Great wife, making sure. Yes, she's taking good care of me and does not want me to be sick. True or false? Applying Vaseline or Vicks to the nostril passages is effective against infections. As far as I know, David, it's false. I don't know of any true benefit other than anecdotal stories I've heard from people that's helpful. Thank you, Carol. I appreciate that. Crohn's flare, does this increase risk of? So a flare of Crohn's means that your immune system's on overdrive. Pardon the dog barking in the background. So get the Crohn's under control. Number 1, fix your diet. Number 2, talk with your doctor about medications to control that. Which high blood pressure drugs can replace ACE inhibitors? There's 6 different classes, Roseanne, and in each of those classes, there's at least 10 different drugs. So that's a whole topic in and of itself, and I would talk with the doctor about that. And my concern is your naturopath probably won't know that. You need to go to your regular doctor. Let's see. Every time my kids with asthma get sick, their asthma gets worse. So the mechanism, David, is that so asthma is an inflammatory disease around the bronchial tubes. And when your kids get sick, you increase inflammation. That inflammation stimulates cytokines to flare, which causes that narrowed tube to narrow even more. So asthma is an inflammatory disease that's exacerbated by other infections or inflammations. Hopefully that's clear. Have you addressed vitamins and supplements? So I'm a big proponent of melatonin every night and zinc. Those 2 have been shown to diminish the susceptibility to the virus in small studies. I think China was where I saw a couple of them, and South Korea. 5 different studies showed that. So zinc and melatonin. And I talked about that in a couple other videos. And if you go to docmuscles.com, click on the coronavirus tab, and I've got a whole page that I dedicated to information about this. So hopefully it's helpful for you that way. I have a bunch of surgical masks left over from my son's leukemia treatments. You know what? If you have surgical masks, Neil, that's great. Use them. I don't see any problem using them. If you have excess to donate to your medical clinics, you might consider donating them. But if you have a mask and you don't have the ability to make your own, and you've already got them, great. I see no problem with that. They're yours. Use them as you please. I'm just telling people, don't go out and buy more and suck up the supply. But if you already have them and they're in your house, use them. I see no reason to use them. Tylenol, ibuprofen, you get the virus. So number 1, Tylenol is fine. Number 2, ibuprofen has some suppressive effect on the kidney function. In people who already have chronic kidney disease, people who are already very susceptible to the virus, if they were using large amounts of ibuprofen to treat the body aches, and they already have stage 3 or 4 renal disease because they were behind the 8 ball and they have metabolic syndrome, that's where the ibuprofen became problematic in those patients. And so the issue was, be careful using ibuprofen to treat the body aches with this particular virus because of its effect on the kidney. But just because you take ibuprofen doesn't mean you're going to get it. That's not what that means. There's so much misinformation about that. What about activated carbon? Does that help ward off the germs? I've not seen any study that shows that, other than it makes you vomit black stuff. The only reason I would use activated charcoal, activated carbon, is if you ingested something bad. That's a whole other reason to use it. And I would only use it in great care because it can actually be dangerous. I'm not a big fan of using that. And I've not seen any study that makes me think that using it regularly to ward off a germ is helpful, Teresa. Which is better, paleo versus keto for high cholesterol and pre-diabetic? Michelle, only 1/4 of the patients that use paleo in my clinic ever saw success. I was not one of those that was successful with paleo. The other 3/4 I couldn't get the cholesterol and diabetic numbers down without keto. So I have a few patients that can do paleo and they get away with it great. 3/4 of my patients can't. Could high insulin be the cause of my high LDL cholesterol? Lisa, in my perspective, high LDL cholesterol is due to insulin resistance and high insulin. It is directly related to that. Directly. When insulin comes down, your cholesterol comes down. I wrote a whole chapter on that in my book. Check out the Keto Cure. We wrote here a whole chapter on the cholesterol and how the high insulin actually causes the cholesterol to rise and increases your risk for atherosclerosis. You are very welcome. I have rambled now for 45 minutes. This was going to be a short video. Apparently not. So I was going to go back and summarize, and you guys asked a bunch of good questions. So summary number 1, triple layer mask. Use your triple layer mask. Cotton, fit interfacing, and cotton. It can be made, the cotton seems to be the most breathable and is the most comfortable and seems to provide the most protection as the outer layer, the 2 outer layers. Fusible interfacing, for those of you who sew and know what that is. I had no idea what that was until I married my wife. And now I have interfacing. We have a whole room with interfacing that's available. But she's a seamstress, and those of you that do sewing understand my plight. And then a great resource that my wife has used to make the really cool Star Wars and Star Trek masks that I have and I'm using in my office is tianascloset.com. That's the link to the mask, so you can find that out there. Go to Amazon. You can buy the book. You can go to docmuscles.com and get a copy of I'll sign it for you and send you a copy. That's the other way to get it. But Amazon has it. It's on Amazon for the paperback, the Kindle version, and even Audible is available. You are very welcome, Muriel. Let's see here. Fever. Do you take something to bring it down? Tylenol. In this particular case, if you had this virus, I would give you Tylenol. Would be my approach. Let's see. When is the best time to check your fasting glucose? When you first wake up, before you've had anything to eat. You are very welcome for answering all the questions. Let's see here. I think that's all of them. All right, guys. It's late. It's 9:15 here in Arizona. It's probably midnight on the East Coast. And for those of you on the other side of the world, I have no idea what time it is there. Check out my website, docmuscles.com. I'm going to roll this video over to YouTube. And so if you're on YouTube, please subscribe right there. This little red button that says subscribe. Click on that if you like my stuff. If you didn't like this, please don't hit the subscribe button. Don't hit that button. But if you liked it, hit the button. Follow me. I appreciate it. And if you're on Facebook Live and you want to get notified that look over here. There's a button over here to get notified when I go live. I try to put these up on Facebook, and then once they load, then I'll pull them over and move them to YouTube, so they're easier to access from YouTube. All right, guys, remember, keep the fat high, keep the carbs low, get rid of the garbage, pass the bacon, and over the next few weeks, wear your mask. Talk to you later. Have a good night. Bye-bye.